Each lung is conical in shape, covered with visceral pleura and attached to the mediastinum by a bronchus, blood vessels, lymph vessels, and nerves. The parts of the lungs include the apex, which projects upward through the superior thoracic aperture into the root of the neck, about 2 or 3 centimeters above a medial third of the clavicle and at the level of the neck of the first rib. Then we got the base, which is also known as the diaphragmatic surface, which will be right here inferiorly. And this is directed inferiorly, concave, and it's related to the diaphragm. This is the diaphragm, as you can see right here. There's also a costal surface here and here, which is convex. It's related to the ribs, the costal cartilages, and the intercostal spaces, and a mediastinal surface where you would see that faces medially related to the mediastinal structures. Now let's discuss the borders of the lungs. We're going to start with the anterior border. This is a very thin and sharp border, and it overlaps the pericardium. It separates costal and mediastinal surfaces anteriorly on the left lung, right here, and it has an indentation called the cardiac notch, which is this right here. It's limited inferiorly by a tongue-like process of the superior lobe, which we call the lingula, which is this right here. Now the inferior border, which is this right here, it's also thin and sharp and separates the base from the costal and mediastinal surfaces. The posterior border is smooth and rounded, and it separates the costal and the mediastinal surfaces posteriorly. And the hilum, which is an area on the mediastinal surface through which the bronchus and the blood and lymph vessels and nerves enter or leave the lung. So here you can see the pulmonary artery, pulmonary veins, primary bronchus, and part of the secondary bronchus here on the hilum. And so these structures that enter or leave the lung as a group are surrounded by a cuff of pleura and are referred to as the root of the lung. Now we're going to start with the lobes and fissures of the lungs. The right lung, which is the one you're seeing right here, is slightly larger than the left lung. And the right lung is divided into 3 lobes. It's going to have a superior lobe, a middle lobe, and an inferior lobe. And this is divided by 2 fissures. We have a horizontal fissure and an oblique fissure. Meanwhile, the left lung, it's divided into 2 lobes. Typically, we're going to have a superior lobe and an inferior lobe, as you can see right here. And it's divided by an oblique fissure. The structures related to the mediastinal surface of the lungs, starting with the right lung right here, it's going to be the heart, the superior vena cava, the inferior vena cava, which is right here. Also the esophagus, which is this structure right here, and the azygous vein, which is not shown in here. As for the left lung, also the heart, the aortic arch, which is this right here, the descending thoracic aorta, which is this one right here, and the esophagus, which is this structure right here. The subclavian artery and vein arch over the superior lobe, and they arch over the superior lobe on their way towards the upper limbs. Each lobar bronchus gives us branches called segmental bronchi, and each segmental bronchus supplies a section of a lobe called the bronchopulmonary segments. Some of the main characteristics of these bronchopulmonary segments include that they are shaped like an irregular cone or pyramid. where the apex is directed towards the hilum, the base is directed towards the surface of the lung. They're surrounded by connective tissue, and they have a segmental bronchus and a segmental branch of the pulmonary artery. The veins are intersegmental, which means that they lie in the connective tissue between the segments. And a disease segment, the reason we use this is because a disease segment can be removed surgically. For example, the smallest area of the lung can be isolated and removed without affecting the adjacent regions. As you can see right here, there are 10 bronchopulmonary segments in each lung, but some of them fuse in the left lung. So we're going to start with the segments of the right lung. As you can see on the superior lobe, there's an apical, posterior, and anterior. In the middle lobe, there is a medial and a lateral segment. And in the inferior lobe, there is a superior, anterior basal, posterior basal, and medial basal, as well as a lateral basal. The segments of the left lung will include on the superior lobe the apicoposterior, the anterior, superior lingular, and inferior lingular. And in the inferior lobe, there is a superior, anteromedial basal, posterior basal, and lateral basal. Lastly, on this video, let's talk about the root of the lung, which is also known as the hilum. This is formed by structures that enter or leave the lung, surrounded by a tubular sheath of pleura, a pleural sheath that hangs loose inferior to the root of the lung, pulmonary ligament. So some of the components in the hilum, it's going to include the principal or main bronchus, which is this structure right here. It's also going to include the pulmonary arteries. Typically, there's one per lung. The pulmonary veins, 2 per lung, superior and inferior. There's also bronchial vessels, such as arteries and veins. The autonomic nerves, such as the anterior and posterior pulmonary plexuses, and lymph nodes and lymph vessels. The main difference between the right and left sides regarding the arrangement of the structures in the root of the lung is that in the right lung, the pulmonary arteries will lie anterior to principal bronchus, and in the left lung, the pulmonary arteries will lie superior to the principal bronchus.